vein and portal systemic anastomosis. The portal vein is the main channel of the portal venous system. Collects poorly oxygenated but nutrient-rich blood from the abdominal part of GI tract and includes the gallbladder, pancreas, and spleen, and carries it to the liver. There, it branches to end in expanded capillaries, the venous sinusoid of the liver, communicating with the systemic venous systems in the following locations: between the esophageal vein, draining into the azygos vein or the left gastric vein, between the rectal veins, the inferior and middle draining into the systemic system, and the superior rectal vein containing the portal system. The submucosal veins involved are normally dilated. The paraumbilical vein of the anterior abdominal wall anastomosing with superficial epigastric veins, with the twigs of colic veins anastomosing with retroperitoneal veins. The paraumbilical vein extends along the ligamentum teres in the falciform ligament and the median umbilical ligament in the median umbilical fold. These small veins establish anastomosis between the veins of the anterior wall and the portal and internal iliac veins. The kidneys, ureters, and suprarenal glands. The kidneys lie retroperitoneally on the posterior abdominal wall, removing excess of water, salts, and waste of proteins metabolized from the blood while returning nutrients and chemicals to the blood, conveying the waste products from the blood to the urine through the ureters to the urinary bladder. The ureters run inferiorly from the kidneys and pass over the pelvic rim at the bifurcation of the common iliac arteries, running along the lateral wall of the pelvis, entering the urinary bladder. The supramendial aspect of each kidney contacts a suprarenal, which is adrenal gland enclosed in a fibrous capsule and a cushion of perirenal fat. A septum of renal fascia separates these glands from the kidneys, so that way they're not attached to each other, and function the suprarenal glands as part of the endocrine system and completely separated in function from the kidneys, secreting corticosteroids and androgens and make epinephrine and norepinephrine hormones. The perirenal fat derived from extraperitoneal fat is continuous at the renal hilum, with fat in the renal sinus. Posteriorly to the kidney, there is an renal fascia, which is called pararenal fat. The renal fascia sends collagen bundles through the fat. The collagen bundles, renal fascia, and perirenal and pararenal fatty tissue, along with the tetting provided by the renal vessels and ureter, hold the kidneys in a relatively fixed position. However, movement of the kidneys occurs during respiration and when changing from the supine to the erect position, and vice versa. Normal renal mobility is approximately 3 centimeters, approximately to the height of one vertebral body. Superiorly, the renal fascia is continuous with the fascia on the inferior surface of the diaphragm, which is called diaphragmatic fascia. The primary attachments of suprarenal gland is to the diaphragm, and inferiorly the two layers are loosely united. The kidneys, the ovoid kidneys lie retroperitoneally on the posterior abdominal wall, one on each side of the vertebral column, at the level of T12 through L3 vertebrae. Take a look in your atlas, the situations of these kidneys. The right kidney usually lies slightly inferior to the left kidney because of the large size of the right lobe of the liver. The kidneys through the person is alive are reddish brown and measure approximately 10 centimeters in length, 5 centimeters in width, and 2.5 centimeters in thickness. Superiorly, the kidneys are associated with the diaphragm, which separates them from the pleural cavities and the 12th pair of ribs. More inferiorly, the posterior surfaces of the kidneys are related to the quadratus lumborum muscle. The subcostal nerve and the vessels and the iliohypogastric and ilioinguinal nerves descend diagonally across the posterior surface of the kidneys. Take a look in your atlas, all these directions. The liver, duodenum, and ascending colon are anterior to the right kidney. The right kidney is separated from the liver by the hepatorenal recess. The left kidney is related to the stomach, spleen, pancreas, jejunum, and descending colon. At the concave medial margin of each kidney is a vertical cleft, the renal hilum, where the renal artery enters and the renal vein and renal pelvis leave the renal sinus. Take a look in your atlas, all these directions. At the hilum, the renal vein is anterior to the renal artery, which is anterior to the renal pelvis. The renal hilum is the entrance to a space within the kidney, the renal sinus, that is occupied by the renal pelvis, calyces, vessels, and nerves, and a variable amount of fat. Each kidney has anterior and posterior surfaces, medial and lateral margins, and superior and inferior poles. The lateral margin is convex, and the medial margin is concave, where the renal sinus and renal pelvis are located. The indented medial margin gives the kidney a somewhat kidney bean shaped appearance. The ureters are muscular ducts 25-30 centimeters long, which means 25 through or 30, from 25 to 30 centimeters long. It can be 26, 27, it can be 28, it can be 29 centimeters, with narrow lumina that carries urine from the kidneys to the urinary bladder. Take a look in your atlas, these descriptions. The abdominal parts of the ureters adhere closely to the parietal peritoneum and are retroperitoneal throughout their course. The ureters are constricted normally to a variable degree in 3 places: at the junction of the ureters and renal pelvises, at where the ureters cross the brim of the pelvic inlet, at or during their passage through the wall of the urinary bladder. These constricted areas are sites of obstruction by ureteric kidney stones. The renal pelvis is the flattened funnel-shaped expansion of the superior end of the ureter. Take a look at your atlas, this description, these sites. The apex of the renal pelvis is continuous with the ureter. The renal pelvis receives 2 or 3 major calyces. Each of which divides into 2 or 3 minor calyces. Each minor calyx is indented by the renal papilla, the apex of the renal pyramid. Take a look in your atlas. Everything related with the posterior abdominal wall, showing great vessels, kidneys, and suprarenal glands. The renal pelvis and its calyces are usually empty, collapsed. The lobes of the kidneys are formed by the pyramid and their associated courses. The lobes are visible on the external surfaces of the kidneys in fetuses. Take a look at your embryology book, where it shows an evidence of the lobes which might persist for some time after birth. The arteries to the ureters arise from the renal arteries, the testicular or ovarian arteries, the abdominal aorta. However, arteries maybe arise from the common iliac, internal iliac, inferior vesicle in males, and uterine arteries in females. When the arteries reach the ureter, they divide into ascending and descending branches. The longitudinal anastomosis between these branches on the ureteric wall is usually very good. The veins of the ureters drain into the renal and testicular or ovarian veins. The lymphatic vessels of the ureter join the renal collecting vessels or pass directly to lumbar aortic lymph nodes and the common iliac lymph nodes. Lymph drainage from the pelvic parts of the ureter is into the common external and internal iliac lymph nodes. The nerves of the ureters derive from the renal, aortic, and superior and inferior hypogastric plexus. Visceral afferent and fibers conveying pain sensations resulting from obstruction and consequent distension follow the sympathetic fibers retrogradely to spinal ganglia and core segments T11 through L2. Ureteric vein is usually referred to the ipsilateral lower quadrant of the anterior abdominal wall and especially to the groin, and where eventually the ureteric calculi are seen. Take a look in your atlas from the medial plane, right? Everything related the structures. Take a look in your atlas, the external aspects of the right posterior wall. All descriptions of the muscles, quadratus lumborum, latissimus dorsi, the renal fascia, the perirenal fat, the external oblique, the internal oblique, the transverse abdominal, the perirenal fat, the renal sinus, everything related to the posterolateral view, where you can see the psoas fascia, the psoas muscle, where you can see the kidneys. Take a look in your atlas, the arterial supply of the kidneys and ureters. Take a look how the aorta is related with all these structures. Take a look at the multiple renal arteries, the extra hilar renal arteries from the renal artery or aorta when enter the external surface of the kidney. Take a look in your atlas, the anterior view, the relationship of kidneys, pancreas, duodenum. Also take a look in your atlas, everything related with the external and internal appearance of the kidneys. The suprarenal glands are located between the supromedial aspect of the kidneys and diaphragm, surrounded by connective tissue containing perinephric fat. The glands are enclosed by renal fascia attached to the diaphragm. They are separated from kidney by fibrous tissue. The shape and relationship of the suprarenal glands differ in two sides. Their triangular right gland lies anterior to the diaphragm and makes contact with the IVC anteromedially, and the liver anterolaterally. The semilunar left gland is related to the spleen, stomach, pancreas, and the left cross of the diaphragm. The middle borders of the suprarenal glands are 4 to 5 centimeters apart. From right to left are the IVC right cross of the diaphragm, celiac ganglion, celiac trunk, SMA, and the left cross of the diaphragm. Each suprarenal gland, enclosed by a fibrous capsule and a cushion of fat, has two parts, the suprarenal cortex and suprarenal medulla. These parts have different embryological origins and different functions. The suprarenal cortex derives from mesoderm and secretes corticosteroids and androgen. These hormones cause the kidneys to retain sodium and water in response to stress, increasing the blood volume and blood pressure. They also affect muscles and organs such as heart and lungs. The suprarenal medulla, a mass of nervous tissue permeated with capillaries and sinusoids, derives from neutral crest cells associated with the sympathetic nervous system. The chromatin cells of the medulla are related to sympathetic ganglion, postsynaptic neurons in both derivations neural crest cells and function. These cells secrete catecholamines, mostly epinephrine, into the bloodstream in response to signals from presynaptic neurons. The powerful medullary hormones epinephrine, adrenaline, which is the adrenaline, and norepinephrine, which is the noradrenaline, activate the body to a flight or fight status in response to traumatic stress, increasing the heart rate and blood pressure, dilate the bronchioles, and change blood flow patterns from increased alertness. The medullary hormones play a role in hypertension. The vessels of the kidneys and suprarenal glands, the renal arteries arise at the level of the four discs between lumbar 1 and lumbar 2 vertebrae. The longer right renal artery passes posteriorly to the IVC. Typically, each artery divides close to the hilum into 5 segments arteries that are and arteries. Take a note that they do not anastomose. The segmental arteries are distributed into the segments of the kidney as follows. The superior apical segment is supplied by the superior apical segmental artery. The anterosuperior and anteroinferior segments are supplied by the anterosuperior segmental and anteroinferior segmental arteries, and the inferior segment is supplied by the inferior segmental artery. These arteries originate from the anterior branch of the renal artery. The posterior segmental artery, which originates from a continuous of the posterior branch of the renal artery, supplies the posterior segment of the kidney. The endocrine function of the suprarenal gland makes the abundant blood supply necessary. The suprarenal arteries branch freely before entering each gland so that 50 to 60 arteries penetrate the capsule, covering the entire surface of the glands. The suprarenal glands are supplied by the following. The superior suprarenal arteries, 6 to 8 from the inferior suprarenic artery. The middle suprarenal arteries, 1 or more from the abdominal organ near the level of origin of the stomach. Inferior suprarenal arteries, 1 or more from the renal artery. Several renal veins drain the kidney and unite in a variable fashion to form the renal vein. The renal veins lie anterior to the renal arteries, and the longer left renal vein passes anterior to the organ. Each renal vein drains into the IVC. The venous drainage of the suprarenal gland is into a large suprarenal vein. Take a look in your atlas or these descriptions. The short right suprarenal vein drains into the IVC, where the longer left suprarenal vein, often joined by the inferior phrenic vein, empties into the left renal vein. The renal lymphatic vessels follow the renal veins and drain into the lumbar aortic lymph nodes. The lymphatic vessels from the superior part of the ureter might join those from the kidneys or pass directly to the lumbar nodes. The lymphatic vessels from the middle part of the ureter usually drain into the common iliac lymph nodes, whereas vessels from its inferior part of the kidneys drain into the common external or internal iliac lymph nodes. The suprarenal lymphatic vessels arise from a plexus deep to the capsule of the gland and from one on in its medulla. The lymph passes to the lumbar lymph nodes. Many lymphatic vessels leave the suprarenal glands. Nerves of the kidney, the suprarenal glands, nerves to the kidneys arise from the renal plexus and consist of sympathetic and sympathetic fibers. The renal plexus is supplied by fibers from the thoracic, especially the lead splenic nerves. The suprarenal glands have a rich nerve supply from the celiac plexus and thoracic splenic nerves. The nerves are mainly myelinated presynaptic sympathetic fibers that derive from the lateral form of the spinal cord and are distributed to the chromatin cells in the suprarenal medulla. Take a look in your atlas, all these descriptions. The thoracic diaphragm. The diaphragm is a dome-shaped musculotendinous partition separating the thoracic and abdominal cavities. Its mainly convex superior surface faces the thoracic cavity, and its concave inferior surface faces the abdominal cavity. The diaphragm, the chief muscle of inspiration, descends during inspiration. Its central part moves because its periphery, as a fixed origin of muscle, and attaches inferiorly margin of thoracic cage and superior lumbar vertebrae. The pericardium containing the heart lies on the central part of the diaphragm, depressing it slightly. The diaphragm curves superiorly into right and left domes. Normally, the right dome is higher than the left. During expiration, the right dome reaches as high as the fifth rib, and the left dome ascends to the fifth intercostal space. The level of the dome of the diaphragm varies according to the phase of respiration, inspiration or expiration, the posture, whether supine or standing, and the size and degree of distension of the abdominal viscera. The muscular part of the diaphragm is situated peripherally with fibers that converge radially on the trifoliate central aponeurotic part The central tendon. The central tendon has no body attachment and is incompletely divided into three leaves resembling a white clover leaf. Although it lies near the center of the diaphragm, the central tendon is closer to the anterior part of the thorax. The cava foramen, vena cava foramen, through which the terminal part of the IVC passes to enter the heart, perforates the central tendon. The surrounding muscular part of the diaphragm forms a continuous sheath, however, for descriptive purposes, divides in three parts. The sternal part consists of two muscular slits attached to the posterior aspect of the hyphoid process. This part is not always present. A costal part consisting of white muscular slits that attach to the internal surface of the inferior six costal cartilages and their adjoining ribs on each side. The costal parts form the right and left domes. A lumbar part arising from two aponeurotic arcs, the medial and lateral arcuate ligaments, and the three superior lumbar vertebrae. The lumbar parts form right and left muscular crura that ascends to the central tendon. The crura of the diaphragm are musculotendinous bundles that arise from the anterior surface of the bodies of the superior three lumbar vertebrae. The anterior longitudinal ligaments